Welcome to St. Alphonsus Wellcast, the podcast where we explore the many facets of health and well-being. This podcast is brought to you by St. Alphonsus Corporate Health and Wellbeing and a generous grant from the St. Alphonsus Foundation. Thanks for listening and enjoy the show.
Hello, good afternoon. This is Kim Kleavland with the St. Alphonsus Wellcast. I'm the family nurse practitioner with the Department of Corporate Health and Wellbeing. And today we have a special guest on, Dr. Abhilash Desai. He's a geriatric psychiatrist with St. Alphonsus in the Memory Center. And today we will be talking about protective factors and risk factors for dementia. Dr. Desai, thank you so much for coming on with us.
Hi, Kim. Delighted to be here.
Yeah, this is great. This has been a long time coming. We've been having this in the works for a while, and we've been really excited to have this conversation and introduce this series of information as well as resources for family members and for patients who have questions about dementia and memory impairment. So tell us what you have to say.
All right. So before we get started, let me ask you some questions and put you on the hot seat.
Okay.
So far, research has identified a certain number of factors that are considered potentially modifiable risk factors for dementia. So how many factors do you think research has identified? Just give a guess. 3, 6, 9, or 12?
I guess I would guess 12.
You're right.
Yay, good.
Right. Oh, my goodness. All right. Second question.
Okay.
Is if all these 12 factors were eliminated from our population, right, our country, the whole world, what percentage of dementias would be prevented? So the answer is 10, 20, 30, 40%.
Oh, maybe 30%?
40%.
40%.
Can
Wow.
you do that? Right.
Yeah.
Exactly. Now, obviously, as I go through the factors, you'll realize how hard it's going to be to eliminate them.
Right.
But so this is theoretical, but just for you to know how much, our lifestyle and how we handle chronic diseases can influence our future risk of dementia.
Yeah, I think that's something we'd all love to hear about. If there's anything we can do to keep ourselves healthy, difficult or not, I think we would at least like to know what direction to head.
Right. All right, one more question. In the next year, across the whole world, how many new cases of dementia will occur over 1 year? So the answer is, 2 million, 5 million, 10 million, 15 million.
10 million.
You're right.
Oh,
my
great.
goodness.
Look at that.
So then if 40% are preventable, right? So let's imagine that we went back into time and we took care of all these risk factors.
Yeah.
Then 4 million people the next year would not get dementia.
Right.
That's not a small number.
No, it's not at all. That'd be a huge quality of life improvement for so
Exactly.
many people.
And again, as you hear the factors, you'll realize that this same factors will influence your length of life, quantity of life. It's a good thing to do that anyway.
Right.
It'll also reduce your cardiovascular risk of, say, heart attacks. It'll reduce your risk of stroke. So as you see, all these things are coming together where, based on your genetics, the risk factors will cause that specific problem.
Right.
So even if I'm not at high risk for, say, dementia, and this is true, I'm at high risk for coronary artery disease, if I follow these things, it will reduce my risk for heart disease.
So there's a little downside to making some of these changes.
There's no downside. Well, downside is that it's hard work.
Right.
Okay, all right, let's get started. So in 2017, the Lancet Commission, very reputable organization, and all the experts identified 9 potentially modifiable risk factors, and I'll go through them. So first is no secondary education or more.
Okay.
So if everybody in the world got secondary education, 100,000 less people will develop dementia every year.
Okay.
So again, education is key, starting early. And the thinking is that you're developing brain reserve or cognitive reserve, basically brain bank balance.
Mm-hmm.
I think it's more to it, with education, you are more likely to understand all the health literacy information and
Right.
follow all the things that we are supposed to do and so forth. So anyway, so that's number one. Then in midlife, so 45 to 65, there are certain factors I've identified. One is hypertension, which means if you treat it, you'll reduce your risk of future dementia. Hearing impairment, which was surprising when I first saw it. But it makes sense because we listen and talk, and that stimulates our brain.
Right.
When people have hearing impairment, they don't engage in social interactions as much.
Right.
They might get depressed. Anyway, but really, in the future, we should start screening for hearing impairment and then helping them take care of that seriously, because not only their quality of life will improve, but their future risk of dementia will go down.
Mm-hmm. Mm-hmm.
Smoking, not surprising,
Right.
but now it's an established risk factor for dementia. Remember, that's separate from your risk factor for heart disease and strokes. So again, if you stop smoking, you will reduce your risk of future dementia.
Right.
And so get all the help for that. And then obesity is also midlife, all right? Increases your risk of future dementia. So maybe the hypothesis is that obesity is linked to inflammation. That is increased inflammation, and then obviously that compromises brain function. It affects our vasculature, so there is decreased blood circulation. So again, we need to realize that all these are modifiable,
Right.
but as you know, it's not easy, right?
Right.
For many of our patients or ourselves. And then there is 4 late life factors. So that's older than 65. So one is depression. Believe it or not, if you have late life serious depression, you are at high risk of future dementia. And sorry to say, but in some cases, this might be the earliest evidence of start of dementia.
Okay.
So that's 2 is different things.
Mm-hmm.
And so we really need to aggressively treat dementia to reduce their future risk, but also closely follow up to see if they have underlying memory problems and help them.
Mm-hmm.
Physical inactivity, not
Mhm.
surprised.
Mm-hmm.
So to me, I think it applies to midlife, but the research is definitely there for late life physical inactivity. Sedentary lifestyle is a no-no.
Mm-hmm.
And so if you dramatically improve that, you will reduce your risk of dementia. Diabetes, not surprising.
Right.
So and then low social contact.
Mm-hmm.
So really, we need to really be very active in our social activities. And sometimes our culture is so focused on sort of achieving in production that we don't spend enough time with friends and family and just wasting time with them, right?
Yes.
So no, time to stop that.
Yep.
So there are 3 more factors, but any thoughts on what I've said so far?
Yeah, I think it's interesting because, these are 12 different factors that independently impact somebody's risk. But then also you think about how they play together. Depression makes people less likely to be active and also less likely to engage in social relationships.
Correct.
Similarly with, hearing loss. If you have hearing loss, it's harder to interact socially, and maybe you aren't able to even have your brain stimulated in the same way because you're losing out on one of your senses part of the time. So I'm seeing a lot of overlap, but also how addressing each one separately can maybe create a whole picture of wellness and health span as well.
Right. So this is both for the people listening, and if they are not sure, they should bring this up with their primary care physicians and providers regarding why brain health for them is important. And this is not just for people who have family history of dementia or, some genetic risks, but in general. One of the biggest risk factors for dementia is age, which means that all of us are at risk because there's a good chance that the average life expectancy is like 75, 80,
Right.
even 85.
Right.
So, all right. So, and by the way, if all these factors, believe it or not, hearing impairment has the highest risk compared to others. So if nobody had hearing impairment, 800,000 less people would get dementia next year.
Yeah, that is. Turn off that rock music.
Oh, my goodness. All right. And then in 2020, Lancet Commission came back because there was more research to identify 3 more potentially modifiable risk factors for dementia. So number 1, excessive alcohol consumption, more than 21 units per week. Second, traumatic brain injury. So seat belts, helmets, and anything else you can do to protect your brain.
Or concussion management too.
Exactly. And then air pollution. So that's where, the government and where we live come in play. So on a side note, 1 in 8 deaths in Europe are linked to pollution. I'm sure we'll have some similar statistics in the
Definitely.
US. So we have 3 more: alcohol, TBI, air pollution. Any thoughts?
Yeah, I mean, I think we've talked a little bit about alcohol on the podcast before, and how we've kind of seen this swing in the other direction with upcoming generations, and how they're realizing the harmful effects of alcohol and abstaining a little bit more. And then there's sort of some of the, if you generalize, some of the middler generations are still imbibing quite a bit. And I think there's a little bit to be said, what other ways can we use to manage stress and to socialize and involve ourselves in situations that maybe are a little less harmful for our health.
Right. So I want to finish with just a mention of some protective factors, which would be obvious. One is moderate to vigorous physical activity. So that's a little more than mild. So anybody who's, interested in truly reducing their risk or protecting themselves should make sure that they are doing moderate to vigorous physical activity. And now we have all these amounts of time and intensity. And so I think people should read up, and maybe in the future we can just talk about exercise itself.
Oh, definitely.
As a whole separate podcast.
Yeah, and I think with cardiovascular disease risk protection, you're thinking about getting so active that you can breathe, but you can't sing, right? Or you can maybe talk, but you can't sing for 30 to 45 minutes most days of the week if you can.
Right.
I think that's what's studied the most, and certainly that's something we can all strive for.
Right. The second is, again, obvious, very rich social life, spend more time with family, friends, have fun, and, if you feel guilty, feel guilt on what I say, a timer, 10 minutes a day, and then your day's quota of guilt is over.
Yeah, exactly.
I'm just kidding. And believe it or not, nutrition. So obviously balanced nutrition, right? We have all kinds of macronutrients, micronutrients, probiotics, and we'll have another show for that. But there is some studies to show that Mediterranean diet plus DASH diet, dietary approaches to stop hypertension, have been linked to better brain function in general, reduced risks of dementia. And so I think in general, if your diet is sad, standard American diet,
Yes.
I would be very sad.
Yes.
And so again, in the past, we didn't realize that we can really alter our health and brain health trajectory. And so the main message is that we need to kick off our brain health and wellness journey now.
Yes.
That's it, Kim.
That's all. Yeah, I think this was super enlightening. I mean, I think, this opens the door to so many different things that we can talk about in terms of how to lower our risk, improve our overall health, improve our brain function. In our house, my kids love to eat junk food. And whenever I try to give them something healthy, we always say it's brain food.
Right,
and it usually gets them going on eating the right thing. And
right.
and I think, those are just ways that we can kind of reframe the way we're looking at our lives in terms of how we can protect ourselves and go forward into overall health.
Right.
So what's the take-home message here? What's the number one piece of advice you would give to someone who's looking to protect themselves from dementia?
Well, make a commitment to really strongly make brain health your priority going forward, and radically alter your lifestyle if that needs to happen.
Yeah, and take such courage. That's great.
Right.
Well, thank you so much for the information today. I think this was really informative, and at least gives us some context moving forward as well about what we can do for our overall health and to protect our brain.
Hey, I've talked about memory. I forgot something.
Yeah.
So that's just me, all right? I think there's going to be increased research on regular meditation, yoga, tai chi, relaxation exercises for 20 minutes that will also have a protective effect.
Yeah, that'll be more research to come on that for sure. I was a little surprised to not hear sleep on the protective factors.
Well, another thing I forgot.
Or risk factors.
No, you're right. So I think in the future we will see more potentially modifiable risk factors added. I think sleep problems, sleep disorders will be probably the first things to come online. Totally agree.
Yeah. Well, hopefully we'll have more research and we can get a study going of our own.
Yeah, for sure.
Well, great. Okay, well, we will see you next time, where we hopefully will be talking about nutrition
Yes.
in regards to dementia with Amy James, our registered dietitian as well. And if you or a loved one feel as though you could benefit from some of the resources from the Brain Center, the Memory Center, you can contact the Memory Center via 208-302-5400 and see a provider there. There is no self-referral process, but you can also be in touch with your primary care provider in order to obtain a referral, or you can always call to get more information. Thank you so much, and I hope you have a great day, and we will see you next time.
Thank you.
Thank you for listening to this episode of St. Alphonsus Wellcast, brought to you by St. Alphonsus Corporate Health and Wellbeing and the St. Alphonsus Foundation. Always be sure to catch new episodes by subscribing to us through all major podcast platforms, including Apple, Google, and Spotify. We hope you'll tune in again. Until then, be well.